Hi there, my name is McCathie and I'm an exercise physiologist. And over the last few years, I've developed a passion for working with cystic fibrosis children and adolescents. This all began in London, working at Great Ormond Street Children's Hospital, and since then I've returned to Newcastle to start my own business and to pursue this passion of mine. Now, in Australia, the current life expectancy of a cystic fibrosis sufferer is only 38 years of age. That's 44 years less than the general population. And for those of you who don't know, cystic fibrosis is a genetic disorder that affects the lungs and the digestive system. Currently, there's no cure, and emphasis is on the management of the disease. However, recent research has shown that there's a direct correlation between physical fitness and survival rates in cystic fibrosis. Put simply, the fitter you are, the longer you live. At Hunter Rehabilitation and Health, we're extremely passionate about using exercise as medicine because we believe that it's the most effective yet underutilised medicine in the treatment of cystic fibrosis. So adolescents with cystic fibrosis are 2 to 3 times more likely to suffer from mental illness such as depression and anxiety. This leads to poor treatment adherence, which leads to increased lung infections, increased hospitalisations, and decreased life expectancy. And these can all be improved with a structured, routine exercise program. The issue is that there's a lack of implementation of exercise outside the clinical environment. Reasons for this could be a lack of education to parents about exercise and the benefits of it. A lot of parents are worried about putting their children into sporting teams and other activities because they don't know what they're capable of. And also there's a lack of structured programs out there at the moment for cystic fibrosis patients. So at Hunter Rehabilitation and Health, we've collaborated with the John Hunter Children's Hospital and Cystic Fibrosis New South Wales to form the Breathe Better program. The Breathe Better program, in the Breathe Better program, the children get to see an exercise physiologist once a week for a high intensity interval training session. This is basically pushing the kids to their absolute limits in a safe and controlled environment to increase their exercise tolerance. We've also integrated the new innovative app called PhysiTrack. And what this does, it provides exercises or exercise videos, patient education, and video calling, all on a smartphone or an iPad that the children can have at home. And we can provide that 24-hour support even if they're not with us at all. So it's great for the patients in rural and remote areas as well. So I'm lucky enough tonight to be joined by one of the participants in our program, Lizzie, and her lovely mum, Jo, and they're going to tell us a little bit about their first 3 months in the program.
Hi, I'm Lizzie. I'm 13 and I have CF.
Lizzie and me had a bit of a chat before we came tonight, and she just told me some things about the exercise program, so I'll share with you. She said, it's been really good fun. I can now do lots of things I couldn't do before. I can jump higher, I can run for longer, I can do more push-ups, I can hold a plank for longer, I can grip with more strength, I can do more skips, I can lift more weights. I can now do all of this, which is really good, but what this means for me, everyday life, is what's amazing. I have more energy, I've had less days off school, which is a good thing. I've had no recent hospitalisations, and we're often in hospital for 2 to 3 weeks, 4 times a year. So we haven't had one since. I have better lung function. I don't have to wear my oxygen mask at night. I feel fit. I can walk upstairs without puffing. I can keep up with my friends. I can join in PE and sport. And overall, I can do lots of things and I can breathe better.
Thank you very much, Jo and Lizzie. So we hypothesised in the Breathe Better program that the outcomes will be improved lung function, improved exercise tolerance, decreased depression and anxiety scores, and also and improve quality of life, not only for the patient, but for the parents and everyone involved. So our goal is to increase the life expectancy of cystic fibrosis sufferers in Australia. And basically, research has shown that it takes, on average, 66 days to form a new habit. And our goal is to try and assist these children in creating exercise as a daily routine habit, as routine as brushing their teeth, because it is that important to them for their health to continue on and turn it into a daily routine. So at the moment, we've got a small cohort of 10 cystic fibrosis patients in the Newcastle region. We want to reach out to as many cystic fibrosis children and adolescents in the Central Coast, Newcastle, Hunter Valley and New England regions. And we want to reach out to them and basically give them the same experience that Lizzie has had. So with a small pledge of $1,600, what that gives is a child gets an oxygen monitor to monitor their oxygen saturations whilst they're exercising. And this provides that safe environment for them to know that they are exercising correctly. And it also gives them 4 months with an exercise physiologist. If we reach our goal tonight of $40,000, we get to change the lives of 25 children in the area, which we would absolutely love to do. And with that 4 months with an exercise physiologist, it's more than enough time to develop that healthy habit of exercise and to also develop the self-management skills to last a lifetime. Thank you.